because I forgot I wasn't even supposed to get on here. Look at I done took my headband off and everything. But anyway, took my earrings out. I was gonna take a shower and then came on here anyway. But this is the mental health check-in. Um, hopefully everything is going well with you guys. Haven't did this in a minute, but I'll just decide to get on here to see who would get on here. Hopefully you guys are doing well. Hopefully your week is going well. Taking care of yourselves mentally, physically, spiritually, and emotionally. Hopefully, got some hobbies that you're into, some things that you can do to de-stress, like yoga, meditation, journaling, gardening, fishing, whatever it may be, playing sports that you like, um, doing things that you like to de-stress, to make sure we get enough sleep, 7 to 9 hours, because you don't get enough sleep, it causes anxiety, depression, could cause stress on your body. So make sure we're getting enough physical activity in 3 to 5 days a week, 30 minutes each time you work out, whether that's running, jogging, hiking, however you get your physical activity in, biking. Some people, I don't know, like playing sports. Some people like playing basketball, baseball, soccer, whatever it may be. But see if anybody comes on here. I probably won't be on here too long. Just see if anybody comes on here. How's your work week going? It is Tuesday. Tuesday. Tomorrow's Wednesday, hump day. Almost through the week. Hopefully everything is going good with you guys. How's school going? Hopefully you guys are making good grades, attending school. Make sure your school attendance is good for the kiddos out there. Any favorite movies? Watching favorite movies that you like. Speaking of hobbies, stuff to do like de-stress. Some people like reading your favorite books. Pick up, which I have to read more. I gotta read more. I used to read, but I haven't found anything I wanted to read. But probably start reading some other books. Probably order them from Amazon and just start reading them. Get into reading more, finding stuff that I like reading. So getting into that. Let's see. I was talking to one of my coworkers. She said she like coloring. Some people like coloring. Some people like doing um, crossword puzzle books. So some people like doing crossword book puzzles, brain teasers, um, bike rides. Some people like rollerblading, like going roller skating, going to the movies. Let's see, having fun with your friends, go out to eat, something like that. Focus on some other things you can do. Focus on your strengths. Focus on the positive things in your life so you don't stress out. Don't worry about stuff in your past. Let go of stuff in your past. Focus on the here and now. Had a conversation with one of the students, and he was talking about that. Focus on the here and now. You can't change the past. You can't change what happened yesterday. Just focus on today, the here and now. You can't even change what happened earlier today. So just focus on the here and now. Stay present. Stay present. Make sure everything is great with you and straight with you mentally. And you're on the right path. Keep the faith. Make sure you're going to church. If you don't go to church, watch church spiritually. Read your Bible. Go to Bible study. Pray day, night. Have faith. Believe in something positive so you can stay on the straight and narrows, have good morals, have good values, focus on solving problems, focus on the future instead of reviewing hurts from your past. Focus on the future instead of reviewing hurts from your past. Focus on your life instead of your illnesses. Which some people say it's hard to do, especially when you're dealing with a lot of stuff, going through things. especially when you're sick, you have multiple illnesses, especially elderly people. Elderly people, I got a couple things wrong with me, but try not to focus on that. I got rheumatoid arthritis and high blood pressure. Hopefully, the high blood pressure is gone because I don't stop. I think the main thing that caused high blood pressure with me was my job. So hopefully that's straight. People get on my nerves, causing me stress, stressing me out. So basically got high blood pressure 3 months after I got that job. So and then she put me on high blood pressure medicine, which I don't like taking medicine. So really didn't like it. And then the medicine she had me on causes issues with your kidneys. And I'm not trying to go through dialysis beyond like older, it affects your kidneys. The medicine that she had me on, it affects your kidneys, and I was like, no, I'm not finna be going through. When I get old, I'm not trying to be going through kidney failure and be on dialysis. So that was a no go. But create a journal or scrapbook with pictures of clippings to help maintain your goals. Set goals. First of all, you gotta set goals. Set some goals, attainable goals, move toward those goals, set up a process where you can reach those goals. I don't know if it's a 3 month, 6 month, 1 year, 2 year, 3 year. Because some people always ask, where do you see yourself in 5 years? Where do you see yourself in 2 years? So set those goals and try to achieve those goals. Make vision boards. People like making vision boards of goals that they want to attain. And one of the things I'm still trying to lose weight, still trying to lose weight for this 40 pounds that I'm trying to lose. I've been trying to eat correctly, going on a month, and I don't know. The scale says I haven't lost anything, which is weird because I've been eating right, but it's crazy. I don't know what's going on, but care for yourself. Care for yourself. Live healthy. Practice good hygiene. Make sure we're taking eating right, eating our salads, cut out processed foods, cut out white rice, white bread. Try to eat multigrain bread or wheat bread. If you're gonna eat carbs, multigrain pasta. If you're gonna eat rice, brown rice, multigrain rice is better than white rice. Cut out the white rice completely. Cut out yellow rice because some people eat yellow rice. That ain't good. That's not good for you either. See friends. See friends. Make sure we have a good friend group. That good friend that you could go to for support, somebody that you can talk to, close family member, somebody that you can trust. Going to them, somebody's not gonna tell your business or put your business out in the street. Honestly, make sure you guys have that close knit friend group. Yeah, a notification came up. I think it was something about Savannah Guthrie's mom, but they did. They got video of the guy, but you can't see his face. But they did get video, so somebody probably do know who he is. But they do got a video out and some like couple still shots of this dude. But yeah, hopefully they'll find her soon. Hopefully they'll find her, and she's okay. She's doing well, and hopefully they'll get her home and find this dude so he can deal with the consequences of his actions. But try to do something you enjoy every day. Try to do something that you enjoy every day. Whether that's I write poetry, I picked up nothing. I picked up painting. Picked up painting, haven't done it in a while, but need to do something with all this paint I got. So I need to start back honestly on the weekend. Start back trying to paint stuff so I can get rid of all this paint that I got from Dollar Tree, but and the little easels that come with it. But let's see what else. Find ways to relax, whether it's meditation, yoga, go get a massage, go to the spa, go work out, go to the gym, taking a bubble bath, taking a shower, um, walking in the park, taking a walk in the park, or just going in the park, sitting in the park, chilling, listening to nature, enjoying the outdoors. Connect yourself with others in your community. You can volunteer. Volunteering is another good thing. Helping people makes you feel better. Create joy and satisfaction in your life. Create joy and satisfaction in your life. Getting enough sleep. Make sure you get enough sleep every day. Doing enough physical activity. Make sure we're getting enough physical activity. And probably not gonna put this into the algorithm because I ain't been on here in a minute. And if you stop being on here at a certain time, they stop putting it out into the algorithm. But doing enough physical activity, attend healthcare appointments, make sure we're going to the doctor, getting men getting our prostate exam, men get your prostate exams, women get these breast exams, getting these colonoscopies, make sure we don't have prostate cancer, colon cancer, any breast cancer, any type of cancer. Taking our medications as prescribed. Make sure you're taking your medication as prescribed by your doctor. Building relationships with others, meaningful relationships, relationships that have value, positivity, relationships with people that care about you, loving relationships, relationships with people that have your best interests at heart, mental self care, learning a subject that fascinates you, reading books, watching inspiring movies. My favorite movie is Newsies. Like watching Newsies. Newsies is good. Which I want to order that DVD or the Blu-ray. Got to order it from Amazon or Walmart. I don't even think they have it on Amazon, but they have it on Walmart online. Probably have to order it because this is my favorite movie. But watching inspiring movies, I like musicals. Practicing self compassion and acceptance, spiritually praying, attending church, reading your Bible, going to Bible study, engaging in self care practice, going back to getting enough sleep, 7 to 9 hours a night, 7 to 9 hours a night, getting enough sleep, eating a healthy diet, exercising regularly, taking breaks from stress. Make sure we're taking breaks from stress, de stressing, practice relaxation techniques, deep breathing, meditation, yoga, social support, connect with loved ones and friends, join support groups or clubs, um, consider volunteering to give back to your community. Consider volunteering to give back to your community. Develop coping mechanisms. Identify and challenge negative thoughts. Identify and challenge negative thoughts. When you're thinking negative, um, identify it. Change that thought. Try to change to find the positive side to it. Try to find the positive side to a negative thought. Learn healthy ways to manage stress. Learn healthy ways to manage stress, whether that's going for a walk or going to the gym or meditation. Meditation. So seek professional help if needed. If you need professional help, seeking therapy, going through trauma, if you're dealing with trauma, whether it's childhood trauma, which we have, um, going through things as an adult, seek therapy, counseling, prioritize your emotional well-being, express your feelings openly, tell people how you feel, don't keep stuff in because that causes stress. Keeping stuff in, keeping your feelings in causes stress. Um, Practice gratitude, be grateful for the things that you have, whether it's small, big, be grateful for what you have, you got everything you need, be grateful for it, because it could be worse. You're not on the street. You got a roof over your head, you got food, you got clothes, you got shoes, you got everything you need in life. So be grateful for the things that you have in life, clean water, a place to go to the bathroom, engage in activities you enjoy and spend time in nature. Engage in activities that you enjoy and spend time in nature. Take care of your physical health. Get regular medical checkups. Make sure we're getting regular medical checkups. Manage current conditions effectively. Don't drink alcohol. It says avoid excessive alcohol and drug use. Avoid excessive alcohol and drug use. Learn about mental health conditions and symptoms. Go to your doctor for that. Seek reliable information from reputable sources like going to a doctor, going to a counselor or therapist. Stay informed about available resources and support systems. Seek professional help when needed if you are experiencing persistent or severe mental health issues such as depression, anxiety, or trauma. It is crucial to seek professional help from a therapist, a psychiatrist, or a counselor. Early intervention can significantly improve outcomes and prevent mental health conditions from worsening. Remember, mental health care is not a one size fits all approach. That's why you gotta go to the doctor, seek therapy, seek counseling, go to a psychiatrist so they can tell you what's wrong and give you the right treatment for whatever's wrong with you. What works for one person may not work for all. That's why you gotta go to the doctor. Um, it's important to seek support from others and professionals when needed. Make sure we 1 in 5 American adults experience a mental health condition in a given year. 1 in 5 American adults experience a mental health condition in a given year. 1 in 6 young people have experienced a major depressive episode. 50% of all lifetime mental illnesses begins by age 14 and 75% by age 24. Suicide is the second leading cause of death among people 10 to 14, which men I'll go back to this whole men thing, but men are more likely to commit suicide than women. Men are nearly 4 times more likely to die by suicide than women. So, men, make sure you're taking care of your mental health. It's not a weakness. It's not a weakness, men. Take care of your mental health. Make sure you go get the help that you need. Tell people how you're feeling. Don't keep it in. Um, emotional health. Emotional health. Self-awareness, recognizing your feelings like stress or joy. Recognize how you're feeling. Like if you're stressed out, recognize it. Um, so start recognizing your feelings and how you feel. Healthy coping skills like meditation, finding hobbies that you enjoy, whether it's fishing, gardening, wherever it may be. Strong relationships, having strong relationships, clear communication and support, having a sense of purpose. Make sure we're having a sense of purpose. Allows us to manage emotions, handle stress, and live fully. It's about navigating life's ups and downs with balance, not avoiding feelings but handling them constructively. So, having a sense of purpose is about navigating life's ups and downs with balance, not avoiding feelings. Don't avoid your feelings, but handling them constructively. Examples of good emotional health are coping, bouncing back after losing a job or facing a personal crisis, using relaxation techniques like meditation, deep breathing for stress, saying no without guilt. Learn how to tell people no. Don't be a yes person. Learn how to tell people no. Self awareness, recognizing you're feeling anxious and taking steps to calm down. Recognizing you're feeling anxious and taking steps to calm down. Identifying your emotions like anger, happiness, and sadness and understanding their triggers. Being kind to yourself during difficult times. Relationships and connections. Talking openly about your feelings with trusted people. Talking openly about your feelings with trusted people. Building supportive connections with family, friends, or community, showing empathy, understanding others' perspectives, purpose, and well-being, finding meaning in life through goals and or activities, finding meaning in life through goals or activities, practicing self-care like healthy eating, exercise or hobbies, feeling content and good about yourself most of the time. Examples of emotional health, chronic stress, or irritability, withdrawing from social activities, or isolating yourself, neglecting yourself, self care or hygiene, using substances to cope with feelings, difficulty, managing strong emotions like anger or sadness, practicing meditation and relaxation techniques helps, spending time with friends, finding time for hobbies to improve emotional health, build strong connections with people, practicing self compassion, practicing gratitude, managing stress through mindfulness. Let's see, exercise, getting quality sleep, finding healthy outlets like hobbies or nature, challenging negative thoughts, seeking professional help when needed. So, that's some things about mental health. Taking care of your mental health, taking care of yourself emotionally, self care ideas, set realistic goals, break down large tasks into smaller, manageable steps, express your emotions, learn how to say no to requests that drain your energy or violate your values, take breaks, schedule time for yourself to unwind and recharge, practice gratitude, focus on um, positive aspects of your life and express your appreciation, develop a positive self-image, accept your flaws and work on building your self-esteem, create a self-care routine, listen to your body, pay attention to your physical and emotional needs, and take action accordingly. So y'all have a blessed day. May the rest of your night go well. Try to see if anybody come on here, but they probably put it out there because I haven't been out there. I haven't been on here in a minute, so I have to start coming back on. So I have to put it back in the algorithm. But thank you. Y'all have a blessed day. If you see this later, I appreciate you watching it. God bless. Take care of yourself. So you can take care of other people. Love yourself so you can love other people. Be kind to yourself so you can be kind to other people. God bless and y'all have a blessed day and a blessed rest of your week.